Hi, my name is Moses. Do you know what are the top 3 critical illness in Malaysia and how much actually are the medical expenses to treat it? Okay, let's start with top 1, cancer. According to WHO data in 2020, there is a total of 19 million new cases and Malaysia had registered total of 48,639 new cases of cancer and 29,530 of cancer-mediated death in 2020. Referring to National Cancer Registry report, the most common cancers among men are lung and nose cancer, while for ladies, cervical and breast cancer are the most common cancer. How about the cost? For lung cancer, it can be up to 56,000 or more. Nose cancer is up to 70,000. As for breast cancer, it can cost up to 395,000 for treatment. Top 2, heart disease. In 2020, there were 18,515 deaths were recorded due to heart disease. 12,707, about 68.6% of the deceased were men, and 5,808, which is 31.4%, were ladies. Average age of death were between 41 years old to 60 years old and above. This can be due to the negative aspect from work from home in 2020 due to COVID-19 lockdown, because lacking of exercise and overeating on unhealthy food and drinks. So, how much you think it will cost to treat heart disease? For example, an angiogram or one stent angioplasty in a private hospital, it will range in between 15,000 to 45,000. On the other hand, a coronary bypass cost in private hospital will range between 25,000 to 80,000. Yes, the total may be up to 100,000 ringgit for treatment. Top 3, stroke. Stroke is an invisible killer in Malaysia. It happens when blood supply to the brain is cut off and causing brain cells to be deprived of oxygen. This will lead to brain cells dead and losing the normal functions of the brain. At the same time can cause death as well. According to the studies monitoring stroke burden in Malaysia on 2017, it is estimated that 150 out of 100,000 Malaysians suffered from stroke with an average daily hospitalization of 92 cases a day. It is also reported that 40% of stroke patients were under 60 years old. And our country, Malaysia, recorded almost 32 deaths daily due to stroke. Besides that, 7 out of 10 stroke patients need to depend on others to live and be taken care of for a long period of time. Treatment for stroke in hospital can cost between 40,000 to 85,000. Well guys, these are the top 3 critical illness in Malaysia. Looking at the treatment cost, does it worry you? I believe that the cost we share here is just on hospital costs only. How about a long-term treatment cost? How about the income loss while we are sick and unable to work? Who will support the family cost of living? Who is going to support us? If you are asking yourself the same questions, perhaps it's time to think of the solution for this problem. Well, the solution is of course very simple and easy. It's insurance. For your information, there is multiple types of insurance you can consider. Mainly is medical card insurance to cover your hospital bill and treatment while you are hospitalized and sick. The next option will be critical illness insurance, which we call it as income replacement insurance. This is to cover the loss of income due to critical illness and unable to work. Well, you can actually plan your coverage based on your annual income times 5 years. Then you will exactly know basically how much you need to cover yourself with medical insurance and critical insurance. That's all from me today. Have a nice day.